projects. I'm sorry I'm no artist, so I did the best of my abilities as far as using or making a diagram of the lymph nodes on the body. On the side of the body, you can see that it is drained by the right lymphatic duct, and over here where it's not colored in, it is drained by the thoracic duct. I used a trifold poster board, and I did mine a little different. I wanted to be sure to include as many pictures and diagrams as possible because I feel like a lot of people learn best and understand the lymph nodes spread better by including this. So for me, that's what I did. And after doing this lymphatic flow presentation project, I have learned the different lymph nodes in the body and how the different cancers assigned to us, how the lymph nodes would be impacted and spread. So let's first start out with the lung. Here I was sure to include a picture of the lung. Over here I have a colored picture of the lymph nodes in the lung. We flip this over, you can see that depending on the location of the tumor depends upon the lymph nodes impacted. Lung cancer that spreads to the lymph nodes can be divided into 3 regions. Intrapulmonary lymph nodes. These lymph nodes refer to lymph nodes that lie within the lungs. These can be either peripheral lymph nodes. These lymph nodes are lymph nodes that are found in the outer regions of the lungs. Also, hilarious lymph nodes are lymph nodes that are present in the region of the chest where the bronchi and other major arteries and veins enter into the lungs. The mediastinal lymph nodes, these lymph nodes are lymph nodes that are present in the area of the chest between the lungs called the mediastinum. Extrathoracic lymph nodes, these lymph nodes refer to lymph nodes found outside of the thorax. These are supraclavicle lymph nodes that are located in the area just above the collarbone and scalene lymph nodes. These lymph nodes are in the neck near the uppermost rib. You can also classify lymph nodes based on the side of the body where they are located. You have the ipsilateral lymph nodes. Sorry, I'm slaughtering some of these words. These lymph nodes are lymph nodes on the same side of the body as the tumor. Contralateral lymph nodes are lymph nodes on the other side of the chest from the tumor. Drainage I did a little differently on my project. I wanted to, from the information that I found, it described the most common lymph node spread, the lymph nodes that would be involved in lung cancer where they would drain into. So the lymphatic drainage of the lung starts with lymphatic vessels that first drain into the intraparenchymal lymphatics and lymph nodes, then move to hilarious lymph nodes, and subsequently move to subcranial, tracheal, brachial, and paratracheal lymph nodes. The lymphatics then communicate with the venous system via the brachial and metastatal lymphatic trunk and the thoracic trunk or via the inferior deep scalene lymph nodes. However, some variants of the lymphatic drainage can vary depending on the location of the tumor. Moving on to the breast, I was sure to include a colored picture of the breast and the different lymph nodes in the breast. On this picture here, you can see the different lymph nodes that can be impacted and spread to you, and they're also named here as well. Depending on the location of the tumor depends upon the lymph nodes impacted. Lymph nodes that can be impacted in breast cancer are the following: supraclavicle lymph nodes, subclavicle lymph nodes, distal axillary lymph nodes, central axillary lymph nodes, proximal axillary lymph nodes, mediastinal lymph nodes, internal mammillary lymph nodes, interpectoral or Rotter's lymph nodes. Drainage, ultimately lymph nodes on the right side of the breast drain into the right lymphatic duct. Lymph nodes on the left side of the breast drain into the thoracic duct. Head and neck, I have a picture here that shows the different lymph nodes, and they're also labeled here as well. And this would be the spread of the lymph nodes that would be involved in head and neck cancer if it came down to it. So let me flip this up here. Again, depending on the location of the tumor, depends upon the lymph nodes impacted. Lymph nodes that can be impacted in head and neck cancer are the following: occipital lymph nodes, retroarterial lymph nodes, parotid lymph nodes, superficial lymph nodes, buccal lymph nodes, submandibular lymph nodes, deep cervical lymph nodes. Drainage, here's a little different. The superficial vessels drain lymph from the scalp, face, and neck into the superficial ring of lymph nodes at the junction of the neck and head. Left jungular lymphatic trunk combines with the thoracic duct at the root of the neck. This empties into the venous system via the left subclavian vein. The right jungular lymphatic trunk forms the right lymphatic duct at the root of the neck. This empties into the venous system via the right subclavian vein. Over here I have the female pelvis. I was sure to include the different organs of the female pelvis, and also over here I have a picture of the lymph nodes that could be the cancer could spread to if it came down to it. Depending on the location of the tumor, depends upon the lymph nodes impacted. There are 5 types of female pelvic cancers. There are cervical cancer, ovarian, endometrial or uterine cancer, vaginal cancer, and vulvar cancer. I kind of combined everything together to make it a little easier. Lymph nodes that can be impacted by female pelvic cancer are the following: lumbar lymph nodes, inferior mesenteric lymph nodes, common iliac lymph nodes, internal iliac lymph nodes, external iliac lymph nodes, superficial inguinal lymph nodes, deep inguinal lymph nodes, and sacral lymph nodes. Drainage: the female pelvis lymph nodes drain into the common iliac lymph nodes. Over here I have the male pelvis, moving on, and I have a labeled picture of all the different organs that are in the male pelvis, along with the lymph nodes in the male pelvis as well in this picture here. Depending on the location of the tumor, depends upon the lymph nodes impacted. There are 4 types of male pelvic cancers. They are prostate cancer, testicular, penile, and also bladder. Female can also have bladder cancer as well, so I could have added that. Lymph nodes that can be impacted by the male pelvic cancer are the following: lumbar lymph nodes, inferior mesenteric lymph nodes, common iliac lymph nodes, internal iliac lymph nodes, external iliac lymph nodes, superficial inguinal lymph nodes, deep inguinal lymph nodes, and sacral lymph nodes. Drainage is the same as the female pelvis. Male pelvis lymph nodes drain into the common iliac lymph node as well. So lastly, large bowel. I kind of combined everything together and have pictures of diagrams here for colon, rectal, and anal cancer and their spread. In this picture here, I have all the different lymph nodes that can be impacted and where the cancers could spread to, possibly. So these are really good visuals. It put everything together for me as far as the different lymph nodes and where everything was located. So under here I have, depending on the location of the tumor, again depends upon the lymph nodes impacted. There are 3 types of cancer that can occur in the large bowel, colon, rectum, and anal cancer. Lymph nodes that can be impacted in large bowel cancer are the following: right colic lymph nodes, middle colic lymph nodes, superior mesenteric lymph nodes, superior mesenteric lymph nodes, periocolic lymph nodes, left colic lymph nodes, inferior mesenteric lymph nodes, ileocolic lymph nodes, internal iliac lymph nodes, pelvic lymph nodes, inguinal lymph nodes, periorectal lymph nodes, para-aortic lymph nodes. drainage again is different here in this large bowel system. The inferior mesenteric lymph nodes drain into structures in the epigastric portion of the intestine, where the colon develops. The lymph nodes remaining in the large bowel drain into the superior mesenteric lymph nodes and finishing to the pre-aortic lymph nodes. Lymph nodes that are surrounding the inferior mesenteric artery drain directly into the pre-aortic lymph nodes. They then drain the descending colon and sigmoid parts of the colon, as well as the upper part of the rectum. Back here, I have the references used that I used for my lymphatic flow projects. That concludes everything. I hope that everybody's staying safe during this coronavirus scare. So, see everybody soon.